Hey, at our UMANG session, just briefly to give you an idea about what UMANG has been, we at UMANG try to bring forth topics and issues that are vital to us, the medical fraternity. We hope to make a difference to our lives while discussing these key issues. So we all are running in our practice, in our lives, trying to achieve, trying to excel, trying to create a balance. And somewhere probably we may be able to help each other and form a support system. That is the aim for UMANG. Men and women generally sought into different faculties influenced by personal and social conditionings. But lately, women too have entered these male-dominated career fields in increasing numbers. What has inspired them? What did they have to endure? How easy has it been for them? Have they been happy with the decision? Today, let's hear it from these groundbreakers who have set the trend for younger generation. So, welcome all of you on the panel today. Just to start with introducing our panelists today, I would like to start with our youngest panelist, Dr. Roshni Agarwal.
Hello, everyone.
Please forgive me because I have not been all inclusive with all the achievements that you all have done for shortage of time, but I've tried to keep the key points in. Dr. Roshni Agarwal has done her MBBS from Kakatiya Medical College with 2 university gold medals. She has joined directly for 6 years of DNB cardiothoracic surgery in Apollo Hospital, Hyderabad. She completed in the year 2020. She's presently working as a junior consultant in Department of CVTS, AIG Hospitals, Hyderabad. She's proud mother of a daughter and proud wife of a gastroenterologist. We have Dr. Medha Bhave. Madam is a plastic surgeon. She's director of Param Hospital and ICU Thane. Laser Cosmesis Aesthetic Clinic at Thane. She's founder, ex-secretary of Association of Aesthetic Plastic Surgeons, Mumbai, Thane. And she's ex-national secretary of Indian Association of Aesthetic Plastic Surgeons. Madam is APSI visiting professor in cosmetic surgery, and she has various original articles and procedures in plastic surgery to her credit. We now have Dr. Shraddha Maheshwari. Dr. Maheshwari is a neurosurgeon, and she's the youngest and third practicing female neurosurgeon in the city of Mumbai and 15th in the country. She has done her MBBS from D.Y. Patil Medical College and has entered directly for her super specialization course, that is DNB in the field of neurospinal surgery at Lilavati Hospital, Mumbai. Following her post-graduation, she has done fellowships in endoscopic minimally invasive neuro and spinal surgeries. She has worked at teaching institutes such as KM and Nair as assistant professor. In 2014, she pioneered the Department of Neuro and Spinal Surgery at Cooper Hospital. Currently, she is founder and head of the Department of Neurosurgery at the same institute. Welcome, madam. We have Dr. Namita Pandey. Dr. Namita Pandey is a consultant breast oncosurgeon at LH Hiranandani Hospital. She has done her MBBS MRCS Glasgow. She has done her fellowship in malignant diseases of breast from Tata Memorial Hospital. She was also crowned Mrs. India, 1 in a million in December 2021. And she has credited this title to her efforts to spread awareness of breast cancer, as the Glamour and Title platform has sensitized the public towards this illness. And we also have Dr. Snehalita Deshmukh, madam. We all know her. We all have followed her, tried to keep her as an idol. She has passed her MBBS in 1960 from GS, General Surgery MS in 64, Honorary FRCS from Edinburgh in 1993. She has taught and practiced pediatric surgery for more than 35 years, has trained 45 pediatric surgeons all over the country, has been former Vice Chancellor, University of Mumbai, former Dean of Sion Hospital, LTMC. Madam has numerous awards, books, publications to her credit for her exemplary and outstanding work. Welcome all of you. Very glad to have you on the panel today. Should we start it's a question answer session. We have tried to formulate few questions that we would like to know about, and we would like all of you to give us some insights into how has the journey been for you all. So we will take it in order from youngest to the senior most. So every question, if it can be passed to Dr. Roshni, Dr. Shraddha second, Dr. Namita, Dr. Medha, and Deshmukh Madam. We'll try and go in that order. Yeah. So coming to the first question, what has made you select this super specialty field despite of it being an uncommon choice? Do you want Dr. Roshni?
Roshni can begin that.
Start.
Good afternoon, everyone. I'm Dr. Roshni Agarwal.
Please unmute yourself.
Am I audible now, ma'am?
Yes, you.
Yeah. Good evening, everyone. It's my absolute honor and privilege to be amongst all of you here. So, coming to the question, I am a cardiothoracic surgeon. So, initially, when I was a fresh pass out from MBBS and all, I was really interested in general surgery, to be very frank. And I had visited Narayan Hridayalaya. It's a cardiac dedicated hospital in Bangalore, which is it's run by Dr. Devi Shetty. So, I mean, after visiting that hospital, looking at the patients and the kind of surgeries they do, and especially Dr. Devi Shetty had inspired me a lot. And I was really too scared to take this branch, but after spending some time over there, I realized that this is what I want to do. I was not sure if I'll be able to do it, but some of his words had inspired me so much, especially when he would treat pediatric hearts and all. I thought it's going to be a huge, it's going to make a huge difference in majority of the children who have congenital heart diseases. I was too naive at that age, but still, some of his words inspired me so much that I made a giant leap towards it. And I think I'm really happy with my decision, in spite of having so many. There's a huge gender bias in this specialty, especially. But I'm striving hard every single day to accommodate in this branch, and it makes me really really happy. So I think that's my story.
Thank you. Dr. Shraddha, would you like to?
Yeah. I believe I've been Destiny's child. Never in my life I thought that I'd pick up neurosurgery as a career option, ever. I think MBBS and no medical background. So I had very minimal idea about what neurosurgery is like. But I happened to appear for the interview for direct super specialty in neurosurgery, and I got selected. The dilemma before joining was whether to take this branch or no, because when I got selected, there were barely any female neurosurgeons, and most of the feedback that I got from people around me who were in this profession was that this branch is not meant for women. However, my friends and my parents especially were very keen that I must take up this opportunity and not just let it go. So I entered neurosurgery saying that if I get something better, I will leave it. So you will have to bear with that. And my parents said, okay, give it a try. I entered in DNB at Lilavati Hospital, and two huge stalwarts of neurosurgery, Professor P.S. Ramani from Sion Hospital and Professor Atul Goyal from KEM Hospital. and were my mentors. And I started working with them. Of course, I did not know much about their, how big they were at that point in time. But something that caught on to me was their passion for this subject. And I think they were the ones who pushed me into this branch, and who just made it all worthwhile. And once I started working with them, there was no looking back. I never wanted to do anything other than neurosurgery. Those initial 2 months, my decision was very clear that this is what I'm supposed to do, and this is what I would be pursuing ahead. So yeah, that's how neurosurgery started, and the journey has been full of ups and downs, but everything worth it. And I think we'll talk more about it as we go ahead in the conversation here.
Definitely, definitely. Yes. Dr. Namita, would you like to
Yes.
say something?
Thank you for inviting me, and thanks that I'm on this panel today. My journey started when I was in my MBBS, and my very close friend, in fact, my best friend, was diagnosed with breast cancer, and I was in second year MBBS. I had very less knowledge of it at that time. You hardly tend to know about the disease, but I saw her suffering, especially when she underwent mastectomy. It was a very aggressive disease, of course, because she was too young to get the disease. And she did not die of the disease. She died because of the trauma of mastectomy, in the sense, post mastectomy, when alliances used to come, I used to be with her. And I saw people, in-laws talking in public, when they are sitting and talking about the marriage, they are talking that, she doesn't have a breast. So should we go ahead? Do you have this disease in your family? And that used to be very, very embarrassing for her. She used to cry, and she stopped. She asked her father, "You stop talking about my alliances, because I cannot take it anymore." So later on, she did not die of the disease. She committed suicide because of this, and it caused such a mental trauma to me. I decided I'll do something. So that I was very naive. I thought I will not let any woman take mastectomy as a treatment option. I'll do something about it. Being a doctor, you get that feeling that, I should do something about it. So I was very clear that I have to take surgery, because that was the way out. And at that time, breast surgery was not a super specialty in India. And till now, to my surprise, it is not, because not many people, I work in an affluent society like Hiran and Nani here, and still people are not aware that breast is a specialty, and they should come to a breast surgeon rather than going to a gynac. So then I wanted to go to UK to pursue my further courses, but then I got married, and you all know all the questions starts after marriage as to things change after marriage. So I couldn't go to UK for my training. Then by luck I met Dr. Barve in one of the conferences, and he said, "Come to Tata, we will train you." So when I went to Tata, I was very clear that I'll be taking breast as a specialty, though my colleagues and my peers used to make fun of me कि कुछ नहीं मिलेगा तुम्हें सिर्फ breast करके क्या, you should do a general onco rather than doing only breast. So at that time, even fellowships were not there. I passed out in 2009, and since 2010 the fellowships in breast started. So for me it was a very difficult call, because everywhere I was told कि तुम्हें, you will not be able to be successful if you take only breast as a specialty. But the trauma which my friend had undergone created such a big impact that on me, that I wanted to take only breast. I will do a focused thing, and I will do only in one subject, and I'll try to be the best in this, was my thought, were my thoughts since beginning. And thankfully now breast is being recognized as a different, complete different super specialty branch, and it is doing well. And thankfully patients are, I'm able to do some justice to the cause which I had taken. And I am getting trained in oncoplasty breast surgery, which is the highest course of breast cancer training in UK, and I'm in my final year now. So I think I'll be able to do justice to this branch, and that's how I selected this branch.
Very nice, excellent.
Thank you.
Dr. Medha, uh,
Thank you, Prajakta and Gauri, for inviting me. Actually, for me, the dilemma started when I passed my MBBS. I was getting medicine and surgery, and everybody said I had no medical background at home. And they said medicine will be much easier to practice. ह्यांच्या बायकांकडे कोण सर्जरीला पेशंट येणार आहेत, nobody will trust. So actually, I took up medicine and worked in medicine for 2 months. And I realized that it was not my launching, because when I was doing an internship, I was already given to do hernia, hydrocele. I was doing many sections, and I thought medicine was not what was the call of my heart. And I resigned from that post, and my whole class had assembled to watch my resignation, because it was not easy to give up residency and take up studentship. But I was very lucky to get posted in MJ Joshi unit, and Dr. VG Joshi was my guide. The next block came when I was already married. I had a child, and as I started working in Thane, I realized that as a woman, nobody is going to care two hoots for me as a surgeon, and I will have to have some qualification with me. Having been trained under a stalwart like Dr. MJ Joshi in gastroenterology, I would have loved to do MCH in gastroenterology, but that time it was not available. I was also exposed to neuro and cardiac surgery because I had done rotation in neuro, and MJ Joshi unit had allied cardiac surgery with them, and I was adept at everything. But then as I gave entrance exam and I got selected, I considered plastic surgery to do my specialization, mainly because I thought with a child at home, it will be a little easier. Neuro and cardiac, they have very long hours. But as I entered plastic surgery, I realized there was a lot of trauma, lot of hard work, and I decided to take up the challenge, and I could come out with support of my husband and my mother.
thanks, ma'am. Thanks. We are coming to that. That is our second question.
Yeah.
Nishmukh, madam, please, can you share your experience?
My experience is entirely different from what this younger generation has made. Because those days were such that surgery was not the choice of any female student. I decided to go in for surgery because my father, Dr. Zubaykar, who was the dean of KEM Hospital, had passed MS in the 4th attempt and could not practice surgery, though he wanted to be a surgeon. But he was known as an administrator. So I said, this is what is the fate of my father. I must also pursue surgery. And in those days, ladies were criticized for taking up surgery. My mentor was Professor P.K. Sen, great stalwart. He used to call my father as J. He didn't say Jograker, he said J. J, I'm telling you, persuade your daughter not to go in for surgery. She will not be able to stand up to the expectations. My father said, then let her decide what she wishes to do. And I continued in surgery. After that, I realized I was in general surgery at that time. I realized that the patients were looking at me when I used to prepare the patient for surgery. They won't allow me to scrub. They will say that you are a nurse, you don't have to do it. I felt Whether it is a nurse, whether it is a ward boy, preparation is preparation. But even then, they continued to harass me and didn't allow me to touch any part of the body. So I got too frustrated, young as I was. And then I decided that general surgery is not for me. I should take up something where I will be accepted. And then at that time, Dr. R.K. Gandhi, who was my boss, and Dr. Subhash Dalal, they both came from London and started pediatric surgery. Formerly, it was Dr. P.K. Sen who was doing pediatric surgery, who is known as a cardiac surgeon. But we were doing tracheoesophageal fistula repair, and his hands were very big, so they didn't enter into the chest. And he felt that this surgery is not worth it. So he left it at that. That child died. I felt that if this is so, my hands are not as big as Dr. Sen's hands are. I should be able to do it. So I joined Dr. Subhash Dalal and Dr. R.K. Gandhi's unit. Subhash Dalal was in Vadia Hospital and R.K. Gandhi was in KGM Hospital. So we continued the surgeries. The results were not very good. Actually, the mortality of tracheoesophageal fistula at that time was very high. But even then, we continued persistently. And now the time has come that practically all tracheoesophageal fistula surgeries are successful. So I felt very happy. The time when I felt very happy that I changed my decision to go for general surgery to pediatric surgery was right. When a child of a Wilms tumor was admitted in KUM hospital and we had to operate on that child. While I was taking him for surgery, his mother came. The child was hardly 9 months old. His mother came and said, "Bai, मी हे मूल तुमच्या हातात दिलेलं आहे. तुमच्या हाताला यश येऊ दे एवढीच मी प्रार्थना करते." It was a large tumor and I felt that it may not be possible for me to remove the whole tumor as a whole. But probably her prayers were with me and I could remove that Wilms tumor fully without being broken in the hands. The minute I came out of the theater and told the mother, she bowed down. And believe me, every year on not on his birthday, but on the day of where the child was submitted to surgery, she would telephone me, "Bai, तुमचा बाळ चांगला आहे." And the happiest day in my life when she said, he was that time 23 years old at the stage when I was talking to her. She said, "Bai, तुमचा बाळ आज CA झाला." I was so thrilled and I was so happy. It was probably Wilms tumor which was in stage 1, though the size was big, but other things were in favor. So it had a favorable prognosis. And that is why I felt happy. Even now I feel happy when the patients' mothers telephone me and say that he's doing well. So this is what the story goes. But I still remember that these hernia hydrocele patients will not allow me, accept me at all. But now I know there are no regrets at all. The children have accepted me. Their mothers have accepted me. So things do change.
Yes.
But the decision should be a very thoughtful decision. I won't say wise decision, but thoughtful decision. And decision making is an art. So there are many
ma'am.
books on decision making. How do you take decisions?
Yeah. I think Madam will move on to next question now.
Yeah.
Yeah. Madam, can I just request you to adjust the camera? We can't see you completely, if that is possible.
It's not worth looking at me.
हाँ नाही मैं पूर्ण चेहरा दिसत नाही थोड्या पुढे
नाही दिसत आहे.
हाँ आता दिसतंय it is little better but if there is still chance you could
नाही
see
साईडला
that.
घेतली थोडं.
हाँ चालेल मॅडम
पण हे सेंटरला आलंय ना.
हाँ नो प्रॉब्लेम मॅडम this is better जसं तुम्हाला कम्फर्टेबल असेल तसं.
नाही मला सगळं कम्फर्टेबल आहे.
So I think we'll move on to second question now. I think while discussing, we all got to know that some of the decisions were decided or based on some issues in maybe a personal life or the family life.
Yeah.
So I have always been curious to know because I think this is universal when women decide about post-graduation or super specialization. It may not be for all women, but sometimes marriage or choosing a partner always remains an issue in the life, either for her or by the family, by the parents. And second is the branch that she's selecting. We cannot say that I'm married or I'm pregnant, so I can't do this, I can't do that. So you have sort of a demanding life or demanding portions on both fronts, like being married with a partner that you don't know whether he's supportive. And second, you're demanding a residency and demanding even bosses or your surgical branch. So I would like all of you to tell me or tell every one of us that how was this journey for you? We can begin with Roshni.
Yes, ma'am. So I got married 2 months after I joined my residency. I was in Hyderabad at that time, and my husband was doing his internal medicine in KEM. So he was in third year, I was in first year. And I think after getting married to him, 7 days after marriage itself, we were separated. We were in two different cities. Getting even one Sunday off in a month was very, very difficult for both of us. And we were in long distance for about 5 years. So I think it took a lot of commitment from both sides, a lot of trust, because I was in a completely male dominated branch. He was very busy there. But I think he had utmost faith in me, and yeah, in spite of meeting one Sunday per month, we kept our relationship going because we both understood that we are all working towards a bigger cause. And I think without his support, definitely I wouldn't have done it. And looking at my residency during, I mean, after a couple of years, I got pregnant, and even then, it was very, very difficult. I must admit, it was never really easy. I did my pregnancy also without my husband's support and all that. I was alone all through. But I think the faith and the love we had within each other, pushed us somehow, and here we are. We are stable now. I think every woman goes through that phase. It's just that you have to be resilient at that point, and we all need to look at the bigger picture. And that is what kept me going. And I think most of us would agree with that thing that the temporary hardships
Yes,
are
sure.
always going to
Yes.
be there.
Next.
But if we are fighting towards a cause which is much bigger than that, and we don't look at ourselves as a factor there and look at a bigger picture, I think we're all going to achieve something in the end.
True.
That is what I
So a lot of trust needs to be there. A lot of trust and patience. Who will answer next? One of you.
Dr. Shraddha.
Shraddha?
Okay, so I'm not married actually. I'm single and I'm very happy. Okay. I guess it's difficult to find a partner, especially for me, because when I entered, I was just post MBBS, and most of the proposals that came in were doing their specialty, and I was already into a super specialty course. So that somehow I think didn't click, or it made difference in when I used to meet people. for marriage proposals and things like that. And secondly, it was a long 5-year course, so a lot of them were not ready for a long distance, kind of affair or relationship. So didn't really work out. And then once I passed out and as I excelled in my career, I had already reached somewhere, and most of the people or doctors, especially because when you're a doctor, you look for doctors. Uh, it was not possible for me to find a suitable match at that point in time, and yeah, that's how things have been. But I think my family, my brothers, sisters, my parents, all of them have been very supportive and have been behind me. So I that aspect of my life I fulfill with my sister's children or my brother's children, and I'm happy. So
That's what
I
matters.
think I always say this: you have to be lucky to be married, but you have to be luckier to be single. So I'm luckier.
That's nice. Dr. Pandey?
Dr. Shraddha, we are jealous of you. You're happily single. We are happily married. So for me, I entered into MBBS because my dad wanted me to be a doctor. I always wanted to be a pilot, actually. So during the residency time, more than my husband, I had a love marriage. So it was very easy for me. His understanding was very nice, and we knew each other, so it was very easy. There were times when we didn't speak for a week, 10 days, not even over phone. But my dad used to call me every day. So my dad is my hero. He used to, every day I used to put out my anger and vengeance. Aaj khane ko nahi mila, aaj lunch nahi mila. So I used to be like a crybaby, every time putting it on him, and he used to take it. So my dad used to make sure that every day he gives me a call. And there were times when I used to be frustrated. I just used to pick up a call and cry that this is being too much. I'm not a workaholic, actually. I accept that thing. But then he stood by me. He stood by me. Chalo, theek hai, this will also pass by. You'll be happier once you finish your thing. So that's how I coped up. It was just my family support and my husband's understanding. Actually, I mean, I don't. This is what the dictum is, that behind every woman, every man's success, there's a woman. But for me, behind me, there were two men, my husband and my dad.
That's nice. You're lucky to have a father like that.
Yes, I am. I am really lucky to have a father like that. I mean, he supported me during my childhood, and he really carried me, throughout my professional courses. So my dad is my hero, and thank you to him. I owe it to him.
Sure. Veda, madam?
Actually, I also got married. I got married when I was about 6 to 7 months into my residency, and I was in Pune and my husband was at Thane. But the question whether what would I do never arose. I just got an inkling of it when I went to tell Dr. M.J. Soshi sir about my marriage. And he said, "Are you then shifting to Thane?" I said, "No, sir, I'm going to complete my training here for 2 years. Your husband seems to be a generous boy." So since then, actually, I realized that I have to really admire and respect my husband for letting me continue, because there were some examples at my time of the girls who got married and they left their courses. So not only did I finish, my mother really took care of me. She supported me through all my highs and lows. And I had a daughter, and then with her I shifted to Thane. And then I wanted to give my MCH entrance, so my husband supported me fully. And I got an admission. I remember Deshmukh madam was there for my interview, and my daughter used to be home, and there was support from home also. And one thing I always remember, my daughter always looked at me as a guest, And she used to sometimes call up my hospital in my OT, and all the nurses used to clamor to listen to our phone calls. So she used to sing some poems, and once she also asked me, "Mom, when are you coming to my house?" So that is how it was. So all my colleagues and everyone, they knew this and sort of supported me. And then I completed my MCH nicely. Thank you.
Deshmukh madam, can you just briefly tell us in case it was difficult for you? We have 4 more questions coming in, so I would. We have.
Yes, I'll make it quick.
Excuse me, Deshmukh ma'am, kindly adjust the camera.
Yes.
Madam, the same question. Was it difficult during your time also to give time to the family and time to your residency?
No, for me it was not difficult at all because my mother and father were very next door. Since they lived in the Dean's bungalow, I was working in KEM. I was staying in the hostel during residency. And my hostel mate was Dr. Vidya Acharya, an excellent nephrologist. She's no more now. But she helped me, and I could go ahead with that hard work of surgery.
So I think
it was no difficult.
So I think all of you had great support either from your family or fortunately, despite having non-doctor parents, if you have a strong support, it becomes reasonably easy to complete that course. I think Prajakta, you can go to next question.
Yeah. So I think the key question for the session. See, these have been uncommon fields. You all have created a niche, but along the way, have you ever experienced gender disparity or inequity during, say, very early residency or early years of work while getting work, or from friends, colleagues, and teachers, or in getting opportunities to show your work, or even as bosses? Have you felt that there is a disparity? Roshni, please.
Yeah. Yes, ma'am, there is definitely a disparity. When I joined the course initially, my boss was so adamant for me to leave the course. He said, "No, this is not your cup of tea." So he insisted for the next 6 months. He was ready to refund my fees. He said, "No, you're not going to be able to do it." Somehow, with my dad's support and all, I thought, no, I'm going to prove him wrong. And I was also adamant. So I continued the course. Fortunately for me, my parents, my in-laws, they were all very, very supportive. But it took some time for, I think, the patients to get used to the fact that there is a female cardiac surgeon. Many a times I've seen when I'm sitting in the OPD that a couple of patients have even asked for either a grown-up doctor just to be polite, or they have asked for a male doctor directly on my face. And I have taken it with, again with a positivity, because I thought it's their bad if they are not able to, understand that. And hopefully, I think that this change is going to come slowly. If not, soon, anytime. I hope at least in the future that they accept us overall as a surgeon also. And I think it's slowly changing. And now I've realized that a lot of patients consider me as their surgeon, and they are okay with it. So I think in the last 5-6 years only, I've noticed that change. So I think we're all looking at a brighter prospect in the future regarding this. Thank you.
Dr. Shraddha? Dr. Shraddha, please unmute yourself. Yeah.
Yeah. So yeah, I think, yeah, like you said, this is the key question for the session. So my residency was great. Two great mentors, and they treated me very well, at par with my male colleagues. Never I felt that, I was told that you cannot do this. In fact, probably they were more strict with me, that you have to do this. It was never that you cannot do this, but you have to do this. So there was no, there was nothing which, sort of pulled me back, saying that, no, you're not supposed to do this. Maybe they had soft corner for their male colleagues, my male colleagues, obviously due to obvious reasons, but they never made it, bad for me, or they never made me realize it. So residency was great, and I think if they were not great with me, I wouldn't have really pursued this branch. But yeah, the real challenge started after I moved out of this great environment and a protective shell that I was in while I was doing my residence. So once I moved out of Leelavati and worked in all the major hospitals and big institutes, uh, it sort of became difficult and more difficult. I don't know whether it was because I was the only female in the department, or the male themselves were adjusting to the fact that how to deal with a lady in the department, or it was actually something to do with my gender. Nevertheless, I felt cornered. I felt left alone at a lot of point in time. I was not really included, or you know uh, uh, taken care. I mean, taken as a part of the department and things like that. And there were a lot of ups and downs that happened. And probably that was one of the main reasons when this opportunity, and I would like to thank Dr. Supe, who's there with us today, because he was the one who created this post, at Trauma Center, which is affiliated now to Cooper Hospital, for developing a neurosurgery center over there. And I was so, hell bent that I want to create my own space, and I want to create an environment which will be lucrative for myself to work in. That I just grabbed the opportunity when it came my way. I did not have any second thoughts that how you're going to do it. Probably the suffering that I was going through in the departments that I was working already in was so much more that I just couldn't see the hurdles that lied ahead in setting up a department in a government-run center, from scratch, from ground zero. So I went and I started. I took up the initiative, and with guidance from Sir and of course a lot of people, I started slowly setting the department at this center. Of course, even when you are working at a center, you're doing things, and at an age that I was sent over there, I was not very experienced, or not very politically correct. You're learning, you're still young, you're a little aggressive, and not taken very well by your superiors and things like that. So I had my struggle that way. But eventually and slowly, the department was set. The challenge also came in when you interacted with the patients. Like Madam Deshmukh mentioned, that patients wouldn't allow you to touch. When I used to sit in the OPDs with my male colleagues, and it used to somewhere pinch me very badly that when they addressed the male doctors, they would say, Dr. Sahib, or Dr. Tumi Sanga Kasa hai. And if the patient came to me, his address to me would be like, Acha sister. So I used to get very unnerved that why can't they call me a doctor? Am I not a doctor? I mean, I'm also doing the same thing. But I think for them, it was not really, they didn't mean it that way. But at that point in time, it was something which I did not appreciate very much. That a doctor is a very generic thing, and it is for both for males and females. And then why it is not being used for me? But slowly and steadily, I think as you grow senior in your position, and people start accepting you, people start looking at you with respect for what you're doing. And another I think bias that I would say that I faced when I was working in a government setup, and is something that I faced from the women out there. which is something very disheartening to me. And it is something that, I really feel that we women ourselves need to work upon to support other women and to push them to do more and be supportive of them. So yes, things change eventually. Everything that goes by then during the journey, slowly you things turn around when they look at your work. Your ultimately it's your work that speaks and gains you the respect. So yes, slowly and steadily. Things have changed over the years, and I'm in a happy space now, and we are doing very well as a department also, so much so that I feel proud today that my own mentor Professor Goyal has joined me in my own department, and he's
Wow.
working alongside me. So and when he compliments me for what I have done over there, I think it just makes my journey worthwhile so far.
So nice.
Dr. Namita?
Yeah, Dr. Shraddha, very nice listening to you, and definitely all of us can relate. Similarly, for me, while getting trained in surgery, I actually I had only two biases. The one which was coming from the patient, as she said, most of the time you're being referred as sisters, and it really hurts your ego, your surgical ego. The second bias which I faced was from my side. I was trying to prove myself that I can do at par with my colleagues are doing. In fact, my colleagues used to give me a very good, they accepted me very nicely. My mentors, my teachers, they accepted me very nicely. um, but I had this thing in my mind that I need to prove myself, that I can be at par with my male colleagues. So at that time, these were the two biases which I had faced. Coming to the patient bias, yes, it was definitely very much there. Not as bad as Shraddha madam has faced, but there were times when they used to make me feel that you're not as competent as a male surgeon. So they used to ask for a male surgeon rather than being operated by the female surgeon. But the whole thing got compensated when I entered into breast surgery, because then the patients used to come and opt for a female surgeon. So that used to compensate for the loss of surgical ego, which I had lost earlier. So when I entered into the super specialty, I was very happy, very satisfied that I took this call of being a surgeon, because then the ladies used to ask for a female and they were very comfortable for me. In fact, most of my patients till now, they say that we were googling for a female breast oncosurgeon, though the bias still remains. As you see in oncosurgery, most of it is a male dominated area again. So but still I am happy, because and it gives me a lot of pleasure when I hear it from my patients that we were looking out for a lady oncosurgeon. So I really smile to myself and I say, good job, Namita.
Excellent, excellent. Dr. Medha?
Yeah. Actually, I have faced all types of biases, most of you have shared, but I grew very immune to the bias very soon, because at BJ Medical College, the patients used to call me Tai, Bala, and never called me doctor. But somehow that brought me closer to them. It was a tradition that many patients used to give a box of sweets to the residents when they were discharged, and I used to get the highest number of boxes. And even when I went for rotation, a few patients said, call her, we want to give her only. So that eliminated all the bias. During plastic surgery residency, I had a lot of trouble because my co-residents assumed that I had a child, so I will be giving an excuse and I will be running away at the drop of hat. So on presumption, they used to give lot of trouble, give me heavy duties. But when they saw that I was working sincerely, and finally I hardly took any leaves, whereas my co-registrar, male co-registrar, whose wife delivered in Delhi, he went for 2 months leave. Another co-registrar was unwell, so 2 months leave, and I hardly had any leaves. I worked very well. So then slowly that also resolved. During practice, initially when I used to wear dresses, I realized that patients used to ask, तुम्ही दुसऱ्या कोणाला बोलवणार का सर्जन ना ऑपरेशनला. So I used to enjoy telling them की मी स्वतः प्लास्टिक सर्जन आहे आणि ठाण्यामध्ये आता सध्या 3च प्लास्टिक सर्जन आहेत, त्यामुळे मी कोणाला बोलवणार नाही. So it was that, and they trusted me, and in fact I would say I'm grateful to people in Thane that they started trusting me very early. Reference was a very important point in plastic surgery, and I really opened myself at any time to go and do trauma cases. So I have worked very hard, 4-5 nights a week. I used to be out operating trauma, and naturally the surgeons saw the work and they felt obliged कि इतना रात को काम कर रहे हैं तो इलेक्टिव भी इसको बुलाएंगे. And lastly, in cosmetic, again, many patients are women, abdominoplasties, breast reductions, liposuctions. So there was no question of bias. It was in my favor actually. So that is my journey in biases.
Thanks, ma'am. Deshmukh madam, would you like to say something, please?
Is there? Hello, madam. I don't think she's there. Should we move to next question, Prajakta? We're almost coming to end. It's nearly 6.
Yes, please, please. And we
Yeah.
can come back to madam on this.
Yeah. So the next question, as we...
Madam
Hello?
is there actually, I don't know, but she's probably muted.
So we'll come back to her, sir, so that because it's already 6, so we have 2 more questions to be completed by all. So by knowing this, we knew your story, that how you felt that you would feel the gender bias. I have one question for you all, and then I would request Supe sir to give his comment on this. So this next question comes that any one of you feels that women use gender inequality to their advantage. Do you really believe in it? If no, why? If yes, why? And then I would ask Supe sir to give a comment, because Dr. Supe, everybody knows in the audience that he's trained many women surgeons. So we would like to have his comments also on that. So we'll begin with Roshni. Roshni, do you think females use their gender to their benefit? Do you feel they do
I
that?
think I have myself used it a couple of times to avoid coming in the nights, especially because our bosses used to expect all of us to be available, even to put a chest tube. So I think I have used it myself, which was not right. But as a resident, I think I've taken the advantage of being a female to do that. But now I feel that it was probably inappropriate, and we should not do it, so that we pave a path for the future generations. So we lead them by example, saying we are available, we are equally available as our male counterparts, and that should hopefully change the mind of everyone in the future. So I think, yeah, we have used it. I mean, I myself have used that to my advantage.
You need courage to accept that. Thanks, Roshni. Thanks. But I'm glad that you have changed your practice. Shraddha?
No, never have I used it myself for any kind of advantage or whatsoever. And I am also yet to come across another female neurosurgeon, at least I would say, who uses being a female to her advantage. Not yet. No, never.
That's great. So not for opportunities. Namita?
No, not yet, because while doing this training, I almost forgot that I'm a lady, I'm a female. My mom used to say, the way you walk, none of the boys are going to select you. So I forgot that I could have taken the advantage or anything like that. But no, I haven't. I haven't.
Meena, madam?
a good surgeon is supposed to have ladies' fingers and lion's heart. So all surgeon ladies are royal with lion's heart. And I'm really not, I have never seen a surgeon lady taking advantage of womanhood. In fact, when I joined, my teacher told me directly that I don't want any excuse that I have heavy period. I want you to work day and night 24 hours. If you are willing, take it. So I said, I'm taking it and I'm working day and night as required. Periods is not a problem at all. It's a physiological thing. And we managed without taking any leaves. I have never seen actually.
So not even in residency and not even in your day-to-day working pattern. Madam, you're back. Good to see you back again. So the question was, Madam, whether you think women, either as you or you have seen anybody, especially surgical field, using their gender to their benefit?
No, I've never seen any lady using because she's a lady to her benefit. No.
Okay. So, Supesa, I would like to have your comments because you have trained many boys, many girls.
Yeah.
As surgeons. So,
if your question is very specific, I would say I don't think all the women who worked with me have taken any major advantage. Maybe minorly once in a while they must have taken, but I think they were very upright, and most of them worked very hard to show them equality. In fact, and I don't think they have taken, especially people work with me like Vandana, Aparna, Karmari, and all of those. They were very upright. I don't think they took any advantage of their womanhood. Once in a while, they may have just asked me, sir, for some family or something, but that even the boys also ask. So I don't think they took any extra advantage of their womanhood, except for pregnancy and all. I can understand, but otherwise, no, definitely.
So not for working long hours, not for operating long hours.
No
for
way.
Night rounds. Not for opportunities or not
no,
for projections.
No, at least those who come with to surgery, according to me, see, they definitely come prepared, I feel, with that kind of an. See, there are how many in my own department, if you really look from 1970s and till today, those first 2-3 women we had, Hina Rajdev was there and Sulva Punekar madam, they were very upright and they were very equal, that kind of a thing. And later on, whatever people I had, like Aparna and Vandana, though they were married and all, they never took any kind of advantage. Though sometimes I feel people look very against them, but they themselves have never taken any advantage. I think we should really accept that.
If I can add something here, I think we are so much looked forward that, now see, she will take leave just because she might have some issues, some menstrual issues, or she's carrying. Now you see, she'll take leave. So we are so much under the camera that we want to prove against it. So probably that is the reason why we don't want to take it. Even though we have an opportunity, we can say that, look, I'm in my first trimester and I am not feeling well. I can easily go. But then probably we want to prove it to our unit or to our colleagues that in spite of being in my first trimester, look, I'm not taking leave. As Madam said, Bhavi Madam said that, we want to prove ourselves. So maybe that is the reason which works, that we haven't taken advantage of it.
Yeah, sure. Maybe you're right, Namita. But in fact, when we come to know that somebody was pregnant, in fact, the whole unit probably helped her and adjusted accordingly. That was our unit policy. But I personally feel I have seen those who have been surgeon or super specialist hardly have taken any advantage, because those are also equally ambitious women. And it's a question of how the society adjusts to that.
And I think some physiological, I don't know, but some physiological changes happen. The moment you enter the OT, all the first day menstrual pain, all the pains, they just go away. We are so focused with your work that somehow I feel that when I am in my holiday and I get my menses versus when I'm working and I get my menses, I'm more troubled when I'm in my holidays. And when I'm working, I'm not troubled much. Maybe because you're so focused. Some physiological changes happen that, these things, they don't trouble you much at that time. I think so.
Another thing I would like to add is we are talking of men who themselves are very highly educated and dedicated surgeons. So naturally, even if someone wants to try, they are not going to give in. So credit is equally to the other party.
True.
So, Prajakta, we'll come to the last question. You would do that?
Yes, yes. So now that, yes, like Dr. Namita said, I think that need to prove, need to not falter, need to not have anyone point a finger at you is that walking a tightrope, proving, walking uphill. It has been an uphill walk for you all. So in all this journey, what are the positives that you can come up with that has helped you in this? What are the positive aspects of this journey that will help younger generations who are watching this show? Dr. Roshni?
I think the most important thing which I've learned from my branch is that uh, the patient satisfaction basically in a cardiac surgery, I think. Patients go home safe and sound. And I think that has given me immense satisfaction throughout my career. So I would request other females also to take up this branch, and we need more female surgeons. I think the only I mean the most important advantage which males have is they're surrounded by more males. So I think if that is bridged for us in the future, if we have more females around, we are also going to be more and more confident. I think the world is going to accept us more if we are better in numbers. So I would like to end my session with the same comment that it is a need of the hour that more and more females take up this branch. Thank you.
Shraddha?
I think one thing that I would like to tell to the because this is a session for breaking the bias to the female surgeons or female doctors out there is stop looking for validation. Okay, you're good at your work. Be confident in what you're doing, and you don't need validation for each and everything that you do. So stop looking for it. And I just read somewhere that don't worry if somebody doesn't like you, because most people are struggling to like themselves. Just be focused on your journey and make each day count towards your future. If you are strong-headed, you know your way ahead, opportunities will come and doors will open on their own. So, yeah, I think uh, we need to break the bias, not just gender, not just color, but our own personal biases that we have against ourselves. That's what I would want to say to the doctors out there.
Well said.
Right. Dr. Namita?
For me, I would like to give this message that, we actually put up a fight against ourselves. We create a hostile environment around ourselves. We try to prove, we try to do much better. We try to break the biases which people have. Rather than doing all these things, we should rather enjoy the training, because once the training gets over, once you enter into the grill, the environment is completely different and everybody becomes successful in their field. I mean, if you are dedicated, if you're faithful to your branch, you will be successful. So rather than running in the rat race and doing what people desire you to do, or doing what you should do, or doing better than you, creating a better self of yourself every day, I think we should hold on, enjoy what we are doing, enjoy the residency, enjoy the love that you get, enjoy the tea that you share later on at the end of the day, enjoy the emergency surgery which gets over very nicely, enjoy each and every case. I think that's the thing we should focus on each and every day, and enjoy those training times, enjoy the early phases of yours, because the grill will be there later on. And and something should be there to think out of the box, like the beauty pageant that she was talking of. When I enrolled for it, eyes were raised. My mom was the first one. Kya medical chhod rahi ho? Are you leaving the job? So they no, not everybody could take this, that I applied for a beauty pageant, you know, and I was not very confident because that was not my field. I just did it because I wanted to do it since quite long time. So many eyebrows were raised. In fact, when I was taking leave also, you know, I did not speak this to my colleagues that I'm going for this reason, because I felt, I was not confident. What will be the embarrassment if I don't win and I come back? How people are going to treat me? And second was that to fight against myself, that will I be able to do it? But I just did it. I just did it for the heck of doing it. So if you have any desires, if you want to do something for yourself, not only in the medical field, I should say, the medical fraternity should think out of the box as well. So I was very skeptical that when I return back, how my patients are going to react. So in spite of winning, I had not put up my winning pictures in my social media, in my Facebook or in Twitter or Insta, because I was scared that how patients are going to take it. Maybe my practice will reduce. But to my surprise, you know, the first day when I resumed after winning the crown, the first day when I was in the OPD, I was thinking, should I or should not I discuss about all these things? The first lady who came in my OPD, she was a Tamilian Brahmin, a very conservative elderly lady of 82 years. And she brought a big box of homemade sweets for me. And she said, look, I came to know about this. You won a crown. I'm so proud of you that, you know, my surgeon is also a you know, crown holder, and you made me proud. So I'm very happy for you, you know. And she had tears in her eyes. Seeing that, it made me feel, I think I felt the happiness more at that time, when I felt that my my medical environment is accepting me in such a beautiful way. So this is the message that I would like to give to the younger ones, that, you know, live every moment of your residency, live every moment of your training, and when you come into the real field, try to do whatever you want to do as a doctor, as a mother, as a woman, rather than thinking about the bias, and rather than breaking the bias and breaking your head in that, you just do what you want to do. That's it. Thank you.
Very well said. Yes. Dr. Medha, please.
Yeah. Actually, the first practicing woman doctor of India was born only 150 years back. So women are generally entering very late into these professions, and naturally we are going to arrive a little later than the men who are proficient and they have been following the professions for years. So don't worry, as Shraddha said, that other people's appreciation. But I would also like to say that women should support women. They should accept leadership roles, help each other. In one of my poems, I have written, आई माईच्या जगण्यातून खडे वैरत रहा, लेकी सुनेच्या वाटेवर स्वातंत्र्य पेरत रहा. So women have to support women, they have to be together, and we will definitely excel in our profession, get into leadership roles. And because of unique qualities of women, that is multitasking and empathy, we can change the horizon of the profession by giving it a different perspective. As I did when I became IAP secretary, without spending a single pie, I shifted the whole office onto Google Workspace, and everything became online. The membership doubled. So naturally, it was appreciated. So do something different in your vocation, and you are going to be at the helm of the affairs. Thank you.
Very well said.
Very. Yes. Deshmukh, madam.
Yes, I agree with all the comments that have been made. The only thing which was not said is the devotion to your profession and courage and conviction of what you have decided. You should have the courage to take the challenges and not be subdued by it. That's all. If you have the courage, you will always win.
Absolutely.
Prajakta, should we end now?
Would anybody like to say? Anybody from the audience?
Anybody? I think Dr.
Sanjay?
Namita is there. I think Dr. Ratna. I don't
Yes,
know.
sir. Please.
Can I say something?
Yes, sir. Yes,
Yes,
sir.
sir. Yes,
Please.
sir. Yes, sir.
Okay. First thing, I would like to compliment all of you for your stories and reflections. You know, I think they are great. I mean, I really appreciate and salute all of you for your journey. And I think we have to accept that we have a lot of biases in the community, you know, and I'm sure there is a gender bias. I have been writing about it in various domains, I think so. But when you come to the surgical community, I think it is maybe the same biases do reflect at some times, you know, in the beginning. But over years, I've seen a tremendous change which has come, and people have started accepting this kind of an equalness over a period of time, which is a good thing which is happening. And what is important, as somebody rightly said, you have to prove yourself. You know, once you prove yourself, then the whole surgical community accepts you as it is. You know, this has been happening, especially like, say, my specialty like hepatopancreatic biliary. Even if you go to an international congress, there are not more than, out of say 1600 delegates, you will not see more than 25 women. Now, maybe in some specialties you will see, but some specialties still women have to enter. But now in my own department, there are 3-4 residents who are there. So I personally feel there is a change which is coming. One of the major problem a woman faces is in first 10 years of her career, you know, because that's the time she's fighting with her career, her development, her growth and establishment. And this is where the family and the surrounding support is very important. I think if she gets a good support, I think we can really do. And one thing which I learned into FAMER was a cross-cultural acceptance, you know, like say we have many biases for color, economy, gender. I think we should all learn to accept others and take them with their pluses and minuses. I think that's what, if you start learning, I think in a whole community, we will be able to grow. And then there's nothing like we should say, because she's a girl, she cannot do a job. I think you have to look at their individual competencies and accept it. Now, once you develop that mind, and we need to change that. With my one daughter and 2 granddaughters and 4 sisters, I have been always blessed with women around. So I have always started respecting them from my beginning. But I think this whole concept has to come around and people have to do it. So we need this change, which is changing. And I hope women like you will be the beacon of hope and light for the whole community to show that, yes, not even they are good surgeons, but they are sometimes better surgeons than the men. I think if you really do that, I would be very happy. So wish you all the best and congratulations to all of you. And it's always pleasure to listen to madam. Thank you so much.
Thank you, sir. Thank you so much. Thank you.
Thank you,
very
sir.
much.
Thank you.
So I think we'll come to an end in this session, Prajakta. So I would
Yes,
like to
ma'am.
yeah, so all of the panelists, especially Dr. Deshmukh madam, and Nidha madam, Roshni, Namita, and Shraddha, we thank you and that you took out time and you were honest and very open to share what went across. Wish the session could be little longer, and we had, I think the audience showed the bias, if we see. But nonetheless, I'm happy that we had this session, and I thank you again, all of you, and Dr. Supe also. I think we end from here. Goodbye from all of us, me and Prajakta. So thank you and have a good night.